Hey folks, Chad Duplantis here with Dentist in the Know, and I have a special guest with me. We were at the Chicago Midwinter Convention, and for the past several years, Jeff and Jennifer and I have worked with Clinician's Choice in one capacity or the other. And whether it's in Canada or Aruba, sometimes in Chicago, well, it's always in Chicago, but you know, there's a staple that's always around at the Clinician's Choice events, and it's a really good friend of Peter Jordan and also Peter's father, Ronald Jordan, right?
Yes, sir.
And it's George Grayson. George is a practicing dentist in Windsor, Canada. He's been doing it for a little while. And outside of Clinician's Choice, oddly, we have other connections in his hometown of Windsor, Canada. So anyways, George, glad to have you. Thank you for
Chad.
being
Thank
here.
you. It's good.
I have utmost respect for you. But tell us a little bit about your journey in dentistry. That's kind of where we start a lot of these off.
Well, it started out when I finished the master's in microbiology and immunology out of Queen's University at Kingston, Ontario. And I had previously applied to dentistry, and then I decided I was going to relook at that track. And I went into dentistry at the University of Western Ontario, and Dr. Ron Jordan was the head of operative dentistry, and that's how I got to meet him. And he became my mentor. And I worked for him doing on Wednesday afternoons, 8 restorations on a Wednesday afternoon as a third-year student, and we would compare restorative materials, and everything was different for every single tooth. And from that, we had other people on the team that would photograph it, take impressions of it, and he would analyze it and then do his lectures and his papers in comparative restorative materials, anterior and posterior materials. And he was he initiated the first aesthetic dentistry journal. And that's where I became interested in adult reconstructive restorative dentistry. And he was my friend and mentor.
So you've been with him you were with him for a long time.
Yes.
And he started clinical research dental. When did he venture into supplies? Peter started that, or?
No, yeah, Peter started it.
Okay.
His father suggested the name, and then Peter was assisting his father when he would travel.
Okay.
And the suggestion was start a company. So he did that. And then Dr. Jordan moved from Western to become the dean of University of Manitoba Faculty of Dentistry, still a restorative dentist, and he still traveled the world lecturing, and many people were lectured to by him and received the benefit of his knowledge and his comparative dental knowledge. That's what made all of us really respect him and excellent dentists, because there was a demand of doing it the right way for the right reasons. And this was instilled in all of us that graduated in those early years, the late mid-70s and 80s, while he was teaching both at Western and at University of Manitoba.
So anybody, and I unfortunately never had the privilege of meeting Dr. Ron Jordan, but whenever you hear someone hears his name,
yes,
there's never anything but excellence that comes out of their mouths associated with Dr. Ron Jordan.
So what he would do that no one has done, literally no one has done since, is he would have a set of carousels in the days before our contemporary digital demonstrations. He would have about 12 carousels, which amount to 600 slides, but he would also have another bucket full on the side. He would, over a 6-hour period, show 3,000 to 4,000 slides, and he would give a fact per slide. He'd take a glass of water at 10:30, have lunch, eat by himself. He would have another glass of water at 3 o'clock. Then at 4:45, he would say, okay, we're going to wrap this up. And we who know him would go after that and say, it's time for us to relax and enjoy some time with you. And he would do that every single time.
That's pretty powerful, and it's very, very powerful as a mentor as well. And to have someone like that as a mentor, and I think you're very, very fortunate. When I've asked George on numerous occasions, I want to get you behind the camera. I want or in front of the camera, I should say, somebody else behind the camera, but I want to get you in front of the camera.
Yeah.
And, George says yesterday to me, here's a list. This is what we can talk about, which I love because nobody does that. But the funny thing is I look at this list and I think that we could get stuff from George for a day's worth of content. But since we've been talking about Dr. Ron Jordan, I've never been to your practice, but having known you, I know what type of practice you run, and I know it's high end. I know it's conservative dentistry, and I know that you always do what's in the best interest of the patients. But there's two things on here that I just kind of want to hit a little critically. And the first is that you said conservative dentistry, onlays, crowns, inlays, I want to talk about that just a little bit. But the second thing that you said on here that I think is so powerful, and I cannot stress this enough. It says, read about dentistry. It can be complicated. So first of all, let's talk about your passion for conservative dentistry.
So if I'm dealing with a 92-year-old woman who's lost a front tooth and her partial denture and she's a class 2 and her teeth are touching her palate, I can't put that tooth back in easily.
No.
So I have to figure out a way to make a single tooth Maryland Bridge anterior tooth in a 92-year-old woman. So I can do it in Emax, I can do it in zirconia, I can do it in plastic, but she is a respected woman from the center of the university, and she needs the best. So I said Emax or zirconia. Now I've got to figure out which technician is going to do this for me.
Mm-hmm.
Now, the normal technician that I use is in Hamilton, Ontario, roadside down. And this gentleman in Windsor, who's this massive artist that has done work for me before, does a perfect job. And I photographed it. I have all the pieces, and I told the technician, I said, you've done the perfect job for me. Put it in this lady. She's happy. She's just lost her husband, but she's my surrogate mother. So what are you going to do for your mother?
Yeah.
What are you going to do for each patient? They're like your family. So you want the best longevity to whatever you do. Not just somebody not using a dam and just having them liquid and breathing all over your restorations, and they don't stick.
Yeah.
None of them stick. So don't do it that way. Do it the right way. Use a dam. Do it fast. Do it with powerful loops so you can see and just do exactly what you need. And you want to keep that person in that chair for a limited amount of time because nobody wants to be there. So we just do the best. And if you got the right technician and the right materials in the right sequence, and that's why you have to read about dentistry, because don't mix all your different adhesives with your different materials. Keep the same company, read about it, and listen to exactly what they say and do it that way, and everything will remain intact for a long time. And that gives me, I don't have redos. I have a very rare.
I everything that you said resonates with me. But I'll tell you, sometimes you get that 87-year-old or that 88-year-old patient. Now I'm gonna digest this one first. And you do 87-year-old, 88-year-old patient, and some people treat for the lifespan,
Yeah.
But
Yeah.
no, there's only one person that knows that lifespan. All right, it ain't us, right?
You got it.
So the thing is that you've got to treat that patient with options.
Oh.
And sometimes they're going to decide those options for you. And it's funny because sometimes we sit there and we think, oh, I can do this and I can do that and I can do that. And I had a 87-year-old lady, and this is this one that just sticks out of my mind. And I said, comes in with a raging infection, tooth number 30. And I'm like, this tooth definitely needs endo, if possible, because there's a lot of bone loss on it. This tooth could possibly be extracted. So I said to her, I said, all right, here's your options. Extraction, possibly a root canal, but the endodontist is going to determine that once they started. And I said, and your third option, if you so desire, is an implant. If you extract it. she says, okay. She says, well, explain each one of them to me. So I explain each one of them to me. And this 87-year-old lady looks at me and she goes, I want the implant. Last thing that I would thought that she would have chosen, but that's what she chose, and I just gave her options. But, deep down inside, I want to do what's best for her and I want to do what's easiest and what's quickest. But we just knew we had to get rid of the infection. And that was the way that through our patient education that she chose. And sometimes you have to let them decipher it. But the second thing that you talked about is materials. You are one of the first people that I've found that says the exact same way. I believe that materials are created together to be used together because the chemistry is like, and like chemistry works the best together. Don't buy the cheapest bonding agent. Don't buy, just because it's a cheap bonding agent, don't buy the cheapest bonding agent to go with the most expensive cement or resin or whatever. Buy the one that goes with the resin that you want to use and spend a little money. Your patients deserve it. Don't buy cheap products.
That's right. That's right.
Cheap and good isn't always the same. Sometimes they are, but cheap and good is rarely the same. So, I love that. And I said we were going to talk about those two, but we have a few more minutes left. So I want to talk about one more. Even though you do it properly, it may fail. Talk about that for a second.
Well, I've been doing implants now for 25 years. Yeah, reconstructive, initially installing, but now more reconstructive of it. And 99% of the time, it falls in and everything's perfect. 2 weeks ago, it wasn't perfect. It was a little tiny woman, and I have these big hands, and I got this little tiny impression, and trying to undo those screws and release that impression, not scanned. It had to do it this way with her. And she moved her tongue and she destroyed the impression right around the transfer coping.
Okay.
And that resulted in a contact that was complete. It just wasn't in the right spot. Everything was good. It was distorted enough. And I don't send things back. My technicians, I've learned from way back, if you have a good technician, good materials, proper diagnosis, as you're talking about, and proper education of that patient, so they hear every single version of what can and cannot be done, and you and they will make the right decision. If you're in a time frame problem where somebody's demanding that you do 5 patients in an hour, and you haven't got the right materials, and you're not using a rubber dam, and you've got contamination and things that are going to cause failure, you're really wasting your time, your energy, your intellect, your sanity. You're going to come out of your day not feeling very well. But if you have control over all those factors, even though you lose one factor, like I lost that one factor, she understood. And I explained it to her. I looked at it and I explained it to the technicians. Everybody was in total agreement. The only thing that happened there was she moved her tongue. And I thought everything was isolated and secure, but I missed something. And it's really rare. But once you know, and once you have a little bit of experience, just do the right thing, and it will 99% of the time work out perfectly well. And that's where, when we go back to education, we go back to the discussions that you have with those that are knowledgeable in this building, in the lab across the way, the lab meeting. It's quite remarkable what dentistry is doing to us. It's wonderful what we can do. And when I gave a lecture many years ago to the University of Lawrence University in Detroit, the first-year engineers, I told them that I could glue anything to anything. While that person's awake, and I work in a little tiny cavern of darkness.
Mm-hmm.
Now I have a light. Now I have 10 power telescopes. Now I can glue anything to anything. I can glue gold to gold, gold to silver, silver to palladium, titanium, it doesn't matter, sandblast, whatever you want, glue it all up. But use the right metal primers, use the right adhesives, and things are great. Then you can do Maryland bridges that last for 20 and 30 years. And they're the most difficult. At the same time, the young engineer walks up to me and says, I can't believe what you told us. I said, but it's all true. And in these confines of dentistry and what we do, we can really reconstruct people conservatively, not charge them a lot of money. Don't always have to have a crown. You can you can make attachments to crowns, make distal contacts just by sandblasting it and adding a contact. Strip out those matrix bands, and you've got adult growth. When open contacts now, I can make contacts very easily.
I think, like I said, everything that you say resonates with me. And I think as we cap everything off, I want to hit on a few things. One is practice conservative dentistry.
Yes.
Everybody needs to practice conservative dentistry. Educate your patients.
Yes.
Do the right thing.
Yes.
When something fails, quit worrying about whose freaking fault it is. Just fix it.
That's right. Absolutely true.
Especially if it's as we're doing it, just fix it. Worry about whose fault it was later, you know?
Everybody understands.
Doesn't matter where her tongue was or whatever. It just matters that you're going to fix it.
Oh, yeah.
That's what matters the most, you know? You're not going to tell the patient, you know, lady, your tongue got in the way, and just because that happened, I'm going to have to charge you a little extra for this appointment. I don't know if we're going to make any money off of it. So we're going to, you know, it's just not going to work. And, you know, follow the science, follow the instructions, because you made a very valid point when you were talking to those engineers that there's a lot of things that we can do in dentistry, but the biggest thing it requires is understanding materials, understanding science, and reading the freaking directions.
Sure.
So with that being said, it was an honor. I mean, I've known you for several years now. I don't think I really knew how much of a mentor Ron Jordan was to you, which is actually really, really cool.
And all of my classmates, everybody that went to school around us. Yeah.
That's
significant.
That's really, really incredible. And I would encourage everybody to go to Aruba, go to one of the Clinician's Choice events down in Aruba, because you won't be disappointed. And I can guarantee you're going to meet Dr. George Grayson.
And next year's a good one. Thank you, Chad. Thank you. Wonderful. Thank you so much.
Thank you so much for being here, and have a great day, everybody.